And so, part of that question, John, was not only around the data, but the relationships. When HIPAA was passed, we certainly didn't have so much mobile health and so many vendors that sit outside of the covered entity relationship between other healthcare organizations. And so you have a push for PHRs and that capability. Yet again, those vendors typically don't follow the same rules as healthcare. And the proposal with MU3 is to incorporate more of that data inside of the provider's record on that patient. So do you think there is some extra rule or something that finally needs to be passed? I know that high tech attempted to rope in more business associates, but I'm not certain that it succeeded.
There's probably all kinds of rules that need to be implemented. But we shouldn't rely on the federal government to take care of the problem for us. I mean, there are times when their intervention is justified. For example, with HIPAA, that was probably a good reason for them to get involved. But the industry needs to look at this, and maybe when I say industry, maybe I'm thinking vendors, but probably not all vendors, because I think providers play a major role in this as well. We need to take it very seriously. I mean, one of the concerns that I see in the provider world is that security isn't a priority. And HIMSS just does an annual security survey, and one of the things that we're beginning to see is that the provider industry is now beginning to make security much more of a priority. And I don't know if it's because of all of the breaches that have been occurring and the public and press coverage of all of those breaches or not, but it's a serious issue. And I think the best way to deal with it is to take it seriously, and providers need to implement not just technology, because it's not really all about technology. When I teach, I talk about, technology is just one piece of it. You need to look at the people, because I don't remember if it was Julie or Karen that said it, but the biggest threat comes from within inside with your own employees. So look at that. How do you address that particular threat internally? How do you help your employees understand what the risks are and what to do and what not to do and all of that? And to answer that question, I kind of think back to my military days when I spent in the military. I actually spent 5 years as a missile launch officer, and as you might imagine, we had a plan and a scenario for everything just to make sure that we're ready. Well, pretty much anything we do in the military. I think that's why we have the best military in the world, because we're so anal at planning and practicing. But I think that's the key, is providers need to plan and they need to practice. It's one thing to plan, but unless you practice, it's not really going to help you. It's like taking that plan and sticking it up on the shelf somewhere.
Right. Well, there could be other laws too. Granted, yes, it should be the industry, but one question that we have is, and Julie, you love acronyms, so here you go. Can you speak to FIPA and how it affects health information exchange?
FIPA?
Mm-hmm. Yeah, it says FIPA.
What is that?
You got me on that one too.
The Florida laws that came out, I guess it was last July.
Oh.
I'll look it up.
Okay.
What does it stand for?
So much for a
That's good
security
start.
panel. We don't know what FIPA means.
That's not the sunshine. There was okay.
Yeah. Does anybody know what it stands for?
No, she said what it stands for. That's not something I'm familiar with. Oh, that's a question that came off a card.
Yes.
Okay. Well, he's Googling, so.
Yes. So we will have to get back to you on that.
Okay.
That's a good thing about these panels, live questions.
While they're looking up, let me just talk a little bit about HIPAA. As I said, I was a retired auditor, and I know you're like, oh, please. Okay. So you're all sitting here listening to us, and you're like, I'm hearing all this stuff. What should I be doing? How do I know what to do? So what I've got is, I've got another link for you. It's actually the HIPAA audit. It's 67 pages of a checklist. Mm-hmm. All you have to do is download this, pick a piece of it, and say, where am I here? That's how you do your risk assessment for HIPAA. Because if you ever have a HIPAA audit, this is the tool that they're going to use. And most auditors don't share their tools with you way ahead of time. But this is how you can do your risk assessment. You can look at this and say, where am I on my HIPAA compliance? And this is going to help you in a lot of areas, not just with HIPAA. So again, I have a link for this if you want this afterwards. We'll be glad to send this to you. And remember, you don't have to tackle all 67 pages. Don't let that freak you out. Just take a piece of it. It's divided into different types of sections. You can take a section and say, how are we doing on this section? So you don't have to go on in 67 pages and say where I am and it's going to take me 2 years to figure it out. Just take a little piece at a time and figure out. This will help you determine where do you need to focus your resources.
And going back, FIPA, that just came out of nowhere. And I was thinking healthcare, but actually FIPA covers not only healthcare, but it's a state law that covers all industries that collect sensitive data. So you're talking about financial industries, retail, any organization that does business within the state of Florida and collects sensitive data like your name, your address, your social security number, banking information, that sort of thing. It's a state law requirement that if you have a breach, like we've talked about the other breaches, say for example, Target was last year, Snapchat, there's just been a lot of different breaches. That's a state law requirement that requires a business to notify their customers within the state and then provide them also with credit protection and other ways to mitigate the harm. That's another key piece we haven't really talked about is like if you do have an organization that breaches, what are your responsibilities? And HIPAA and FIPA and really all of these laws have a common thread that you have to, once you've discovered it, you have to promptly report it, and usually that's around between 30 and 60 days, depending on what you're talking about, from the time you discover it, notifying folks. And then you have to, say, open up a phone line where people can call for information. You have to put like an informational link on your website for people. And then you have to think about mitigating the harm for people. So if their credit information's been stolen, your organization may have to or want to offer free credit monitoring for those folks. So if you think about the federal government's breach, the potential cost in trying to mitigate the harm to those impacted to taxpayers could be huge. But what we had in high-tech was the authority of states to implement their own breach requirements and to actually prosecute actors within their state that breach confidential data.
Right, which is the FIPA,
Yep.
as it turns out, the Florida. So if nothing else, you learned a new acronym. Go figure. Very good. You know, I was surprised, guys, to hear in her testimony this week, the head of the OPA actually state when asked, why wasn't the stuff encrypted? And her response was, it wouldn't have helped. So thoughts about that? I've always kind of looked at HIPAA as kind of in some ways the holy grail. I think that high-tech gives special protection around breaches of information that have been encrypted, but do you think she was alluding more to the inside access and the ability to view the data unencrypted?
That's a puzzling statement.
I agree. Well, it could have been because she was being asked about the system they wrote in 1963.
Well, right, and they, I don't know about the ability to go back and encrypt things or how they were even keeping their records. And I'll say too, you know, people are still using paper.
Really?
And there were incidents last year of people disposing of paper patient records and throwing them in dumpsters. So, you know, people are ditching the paper because they've upgraded or they've scanned or they've got an EHR, and now they're kind of on a large scale abandoning their paper. But, you know, if you've still got paper, you have to dispose of that in an appropriate way. And, you know, you got to shred that to a certain, I mean, the law actually tells you how small the shreds have to be. You can't just hoist them in a dumpster in a bunch of boxes. And believe it or not, people are still doing that, and they're still getting in trouble for it. So low tech, we still have those issues.
Very good. And one little area to discuss, I think it's on the concern of many providers, HIPAA audits. Any special advice for living through or preventing that audit, other than following everything you're supposed to follow? And there's the book.
And also, whatever you do, this is what an auditor is going to ask you. You can talk for 4 days answering their questions, but if you don't have anything that's documented, it's not going to stand up. So you have got to document what you're doing, and if you decide to use something like this and you see what the requirements are, you can, and it's not like you have to write a book. It's just answering the question, what am I doing? What am I doing for BYOD? What am I doing for encryption? How are we handling email? I don't think we've even talked about email, but when you're emailing and you attach information, personal information or HIPAA information, do you have a policy on how to handle that if it's sent outside your organization?
So something more
you have any thoughts
substantial
on
than
that?
moving the sticky from one drawer
Yeah.
to the other drawer.
Most of the CIOs I talk to, I travel around the world and visit hospitals and healthcare provider organizations, but certainly here in the U.S., most of the CIOs talk to, the approach that they take is, it's not a matter of if, it's a matter of when. So I'm going to do everything I can to be prepared today, and if an audit comes, I'm going to do everything I can to be prepared to answer that audit satisfactorily. So they're operating, at least the ones that I'm visiting, and the hospitals I'm visiting is based on the EMR adoption model. You saw the slides early in the opening keynote this morning. When I validate hospitals at stage 7 of the model, it's those organizations that have fully adopted EMR technology capabilities. They're the ones that are saying, I've got a secure system, it's redundant, I've got data backed up, but I know that information, particularly medical information, is a big business. So it's not a matter of if I get hacked or something happens, it's a matter of when. So I'm putting measures in place today, and I'm making sure that our staff is educated on what to do and what not to do. So if you approach it that way, that certainly will be helpful, I think.
Very good. And Julie, with all the appropriate legal disclaimers, any final thoughts on you?
Well, my final thoughts would be that depending on what type of organization you're in today, you can always do more. So, if you're a large organization handling vast amounts of data, you have the resources and the mandate, really, to do the most that you possibly can to protect that data. If, however, you're a small physician practice, my thought to you is just make sure you're up to date on HIPAA training. Just start with the very basic stuff and make sure you're covered on all of that. So I always think about, when I'm answering this question, an analogy with you're being chased by a bear, and there's like 10 of you being chased. You don't have to be the fastest person at the front of the pack, but you also don't want to be the slowest one. So really, it's a matter of looking at your peers and seeing how you measure up, and it's calculating your risk, because you're probably never going to be at 100% of where you need to be. But I would take a look at your peers in your group, what you're doing, those standards, and sort of see how you measure up and what you can do better, because you always can.
Very good. And one final question we'll sneak in, and then we'll put a wrap. This is a kind of interesting one. Gets back to some degree of the discussion of de-identification and big data, but this question is, can a patient in of and by themselves be considered PHI? And if so, should that be shared in an unsecured email from a provider to a patient, or vice versa? Just their name, I suppose.
Just their name. So what's the question? So
if I am seeing a a cancer specialist, and I get an email from a cancer clinic, by itself, just that coming to me, is that enough for PHI and that patient being identified? And should that have come through in a, so maybe it's an appointment reminder or whatever. So nothing specific about the diagnosis or treatment,
Right.
just the fact that there's a cancer center sending me a text or an email.
Well, I think that actually does count, because say your wife or your spouse or your kid checks your email and maybe you haven't told them that you have cancer and all of a sudden now they see that. The way you handle that is really simple. When you intake the patient, have them initial or just check a box about whether they're okay with email patient reminders. And then as far as I'm concerned, you're covered. So before you do that, just get that level of consent and have that in their file and update that annually.
Very good. Good legal advice. All right, I think that concludes our panel.
This does not constitute an attorney-client relationship.
Well, thank you guys. Wonderful to have you and great answers.
Thank you.